Yes, good evening. Hopefully everyone is doing well. I want to welcome you to Home-Based Medical Services Television. And my name is Robert Semwes Masaka, the director. And remember, every Friday night, we always have a health topical discussion about how we can live a healthier life. This also happens every Tuesday, again in the night. And this week we've been discussing more about obesity, overweight, and how you can fight it. But I also want to send a vote of thanks to our sponsors. We have the Innovats, the director, Mr. Sempewa John Paul, and Ingnia. Thank you very much for always endeavoring to make sure that we can have these programs running. I also want to send a vote of thanks to the director, Michiana Institute of Nursing and Midwifery. I want to send a vote of thanks to different partners or key players in this sector, where we are focusing on promoting good health, but more important also how to make an extra income. Today's topical discussion is about obesity and how you can fight it and how you can live a healthier life. And straight away, we'll get into our discussion. Today's discussion is going to be about obesity. And the first question that you could have you is out there, is obesity a disease or? But I felt it important that I give you a simple definition of a disease. This is just a state of feeling unease. But more importantly, it can also be a disorder or incorrectly functioning organ, part, structure, or system of the body resulting from the effect of genetic or developmental errors or factors. You can talk about infections. It can result from poisons. It can also result from nutritional deficiencies or imbalance. Then you can talk about toxicity or unfavorable environmental factors, illness, sickness, and ailment. All this leads to a disease. But particularly today, we are looking at obesity. And how do we define? Yes, it is a late night talk show. Very many people could be victims of obesity. You could be overweight and you're looking for a way out. But I want to bring you to your notice that you need to know what obesity is. Obesity is the state of being grossly fat or overweight. That is obesity. And it becomes a disease because of its associated complications, as we will be seeing. And obesity, or in other words, higher than normal body mass index, can occur in adults and children. We are all victims. It causes symptoms including shortness of breath, talk about fatigue all the time, and joint pains, among others. Then you can also talk about obesity can also cause psychological problems. The other time I was talking with my friend who told me one of the things that NAG have most is one talking about their weight. So it becomes a psychological problem, including low self-esteem and depression. That is why at times even find young children isolating themselves from other children. They do not want to play with them because they are overweight and all that. Health conditions such as diabetes. Then you can talk about high blood pressure, often go hand in hand with the obesity. It is very common. Then obesity is preventable. If at all you get to know more about it earlier and then address it just like any other disease. So what is body mass index? When you look at the body mass index, how to get it, you just need to know your weight in kilograms, then your height in meters squared, and then any number you get, you divide your weight by your height, any number you get will define at what rate you are with the body mass index. For example, below 18.5, you're underweight, you need to do something about it. I've seen very many people out there. Then 18.5 to 24.9, it's normal weight, if you have that range. Then from 25 to 29.9, you're overweight. Then you have 30 to 35, that is obese or obesity. Then greater than 35, if you get a number that is greater than 35, that is severe obesity. You need to do something about it. But when we look at the common causes of obesity, who is following us, I want us to talk about genetics. At times you find this condition running in the family. But I have a friend who says it's simply because no one is running in the family. It is not a disease that is running in the family, but simply because all the family is not running, they end up getting obese. And at the end of the day, depending on the circumstances they live in, the things they eat, all those affect them in one or the other. Then the other one is physical inactivity. You want a car to pick you from a garage to work. Then when you get in the basement, you want to use a lift, then back to the car and all that back to the garage. You take air minus sweating. Physical inactivity is also caused. Then very high intake of carbohydrates. Carbohydrates are very vital, but as long as you take them excessively, they also become an issue. Then overeating, I'll take this with frequency of eating. There's somebody who eats again and again all the time. Everything you say something you're eating, but there's again what we call overeating. I remember when we were growing up, I have a sister who ate food and she even failed to stand up. I consider that to be overeating, and it so happens. But again, when it comes to people who eat again and again, everything that passes by your work of place you want to buy, it's a problem. Then talk about medication. There are drugs that will result into obesity. Then psychological issues. Talk about diseases, drugs, very many other things cause obesity. And the common symptoms in adults, how do you know? How do you suspect that you may be obese? You is following us at HBMS TV. Excess body fat, particularly around the waist. At the end of the day, you can't even perform your marital duties as a man or as a lady, simply because you're putting on a lot of weight around your waist and all that. Then you always have shortness of breath, especially when you're climbing stairs, when you're doing some activities. Then talk about sweating more than usual. It's normal to sweat, but as long as it is excessively, it becomes a problem. Then talk about snoring. Then we have what we call trouble with sleeping. Then skin problems from moisture accumulating in the folds of the skin. Then inability to perform simple activities that you once could do before you gain the weight. Then you have fatigue all the time, be it mild or extreme. Then pain, especially in the back and joints, because you're putting on a lot of weight on your musculoskeletal system. Then psychological issues such as negative self-esteem, depression, shame, and social isolation. All these are symptoms. Then when you look at children, they could be the same, but we have some slight changes. Fat tissue deposit may be noticeable in the breast area. I'm sure you've seen boys putting on breasts. This is as a result of obesity. I don't want to mention anyone. I don't want to attack anyone, but you know of people, you know of a culture where these people, most of them are obese in an African setting. Then talk about appearance of stretch marks on the hips and back. Then nigricans, dark velvet skin around the neck and other areas. Shortness of breath while doing physical activities. Then sleep apnea, it's a disorder. Constipation is very common. Gastroesophageal reflux disease, GERD, is also common in young children who are obese. Then low self-esteem, they end up isolating themselves from others. Then early puberty in girls and late puberty in boys. Then orthopedic problems such as flat feet and dislocated hips, dislocation and all that. And I also want to take this seriously, that you need to keep in mind that body mass index isn't always an accurate and final measurement of the body fat content. For example, when it comes to athletics, athletes might have a higher than an average weight simply because they have a high level of muscle mass, and muscles weigh more than the fat. This may technically qualify them to be obese or to fall into the category, but they are not. You get a point, they have very little body fats. So as long as you're an athlete, and allow me to talk about briefly about the complications of obesity. All these that you see, you'll carry them in one plate. Type 2 diabetes is common. A lot of lipids in your body. then obstructive sleep apnea, talk about other diseases, talk about heart diseases, talk about hypertension, talk about osteoarthritis. All these are common depending on the way we live. And these are some of them summarized here with details: high blood pressure, high cholesterol levels. Then talk about stroke is very common. Type 2 diabetes, I've talked about it. Then cancers, asthma, kidney disease, osteoarthritis, gallbladder disease, sleep apnea, then gastroesophageal reflux, hernia, and then the heartburn. All these are common complications. And prevention and management of obesity, health eating plan. Make sure you have a chef. If you've made a lot of money out of your life, have a chef to guide you on how to eat and when to eat and what to eat. Then physical activity, make it a point. At least 3 times a week is very, very helpful for you. Then changing your habits, sedentary lifestyle. Every time you're posing and all that, you need to do something. Then you can also choose to go in for special dieting. Then we have natural weight loss products, and you need to see our recommendation. We have Burn Slim, and then the Live and Burn coffee that has major contents as the green tea, Garcinia cambogia. Then we have the white kidney bean extract. All these things are very vital simply because they are going to help you suppress your appetite. They increase your metabolism. They even remove the urge of eating. They cut out the bad fats. They act as very good antioxidants. All these things are going to help you. But more importantly, allow me also to talk about collagen juice. Collagen juice is omega-3 fish oil combined with vitamin E plus DHA, which is food for the brain, and it's going to help you lose all the bad fats, all the bad cholesterol. And among the major health benefits of collagen juice, to mention but a few, those are some of them. And it helps in high cholesterol level, it reduces them, issues to do with the brain, issues to do with allergies, dermatitis, mood swings, all that, even the dry skin. So these products are very awesome. If you want to have testimonies, you just need to continue following us at HBMS TV. You just need to click the bell and then get all notifications every time we put something. I want to thank you very much for following through, and may God bless all our sponsors. For a vote of thanks to all our sponsors, the Elinovax team, and this is led by Engineer John Posempebwa. We thank you very much for your input to make sure that people can live a healthier life. And I also want to send a vote of thanks to the Director, Michiana Institute of Nursing, that is Mr. Chintu John. Thank you very much for sponsoring these programs. If you're out there and you have a child who you want to do nursing, who you want to do any medical related course, who you want to do other courses, we have a variety of them in that institution. You can always contact us at HBMS TV to make sure that you can learn something. In case you have any questions, you can always come back and learn something. I want to say thank you very much, and may God bless you. HBMS TV, talking health.